Hello! So today we're gonna learn how to eat peanuts. Because everybody says they hate to be told how to do things. And then everybody goes to those videos which, tell you how to do things. So that's BS. People love being told what and how to do. Let's be real. 68% is 68%. Main standard deviation. Look, open gently. So you have the skins on. The skins are where the flavor is. And then gently remove from the shell with the skin on. Buenosimo. Przepiękne. Smaczne. Smakowite. There you go. Then, I don't like Coke, except Diet Coke, caffeine free. That's the only caffeine free drink that I like when it comes to colas. So, always freaking, massage your bean, because peanuts technically are legumes, so bean, and freaking one, taste it, two, taste it. So that's 8 pieces. I do count pieces. So this is not medical advice. I'm not a doctor. I'm not a medical professional. But as I promised a long time ago, I want to tell you what would I do to torture myself? How would I take a psychotropic medication to torture myself? Of course, if I wanted to be healthy and get most benefits of it and least side effects. So the best way, of course, once again, to take your psychotropic medication is to take it continuously, as prescribed. That's what I would do. But, what if I wanted really evil to myself? What if I wanted to get hit with 4 ends of a 2-ended stick? What would I do to myself? Number one, you cannot take medication, which is absolutely the worst what you can do. But what I could do to myself. But what would I do? Hey, I would be on and off, on and off, on and off medication. Okay? So, I would get, number one, I would get the side effects of the medication without medication really working for me. So I would get clubbed over the head with one end of the stick, of a 2-ended stick. So it's one bash to the head with a fucking club. Then, number 2, because I'm on and off, guess what happens? I'm getting hit with the second end of the 2-ended stick, because I'm getting withdrawal effects. Nasty, sometimes. And I'm constantly getting withdrawal effects, because I'm constantly on and off. So I'm getting side effects of the medication and withdrawal effects of the medication. Fucking wonderful, isn't it? Not really. Number 3, I'm sick. I'm having symptoms of my sickness which are not treated, because I'm on and off medication, so I'm not getting any benefit from the medication. So now there's 2-ended stick that hit me already with 3 ends of it. Freaking outstanding, isn't it? And number fucking 4, things like, for example, olanzapine, Zyprexa. Guess what does it do? Olanzapine or olanzapine I don't even know how to pronounce it, and different people pronounce it differently, even professionals. So guess what? Number 4. Zyprexa has been shown at least in one study, and I understand one study makes no science. You have to have one study peer-reviewed and then confirmed by another peer-reviewed study. You can kind of almost get away if you do metadata analysis from other studies. That comes close, but it's still not science. That's almost science. Science is at least 2 studies, both peer-reviewed, both accepted by the peers as for the major part legitimate, and both showing pretty much the same results, consistent results. That's science. So it's very strict. So number 4, guess what happens? Guess what do you get? If you take Zyprexa religiously for 10 to 20 years, guess what happens? If you had previously to take in Zyprexa irregular heartbeat, or if you got irregular heartbeat, doesn't matter which scenario is in your case. If you had irregular heartbeat before taking Zyprexa, or if you get irregular heartbeat because of taking Zyprexa, in a study that took 20 or 25 years, I remember right now exactly, guess what happens? All those people had perfect heart rhythm, no irregular heartbeat at all after 20 to 25 years of taking Zyprexa, a positive side effect. But this positive side effect shows that psychotropic medication affects our nervous system and our heart rhythms. And this is maybe the reason why if you start taking psychotropic medication too late in life, like in your 60s, there is a good chance you may die from it, because your body is too old to adapt the psychotropic medication. So, number 4, you get hit by the two-ended stick with 4 ends of the two-ended stick, because number 4, guess what's number 4? Number 4 is your nervous system, and your heartbeat gets screwed. Because you're taking this off and off, off and on, off and on, and it just messes with your system beyond belief. So my idea about taking psychotropic medication, take it as prescribed, but do pay attention to side effects. And I would talk to my doctor if there were too many or for too long. And one thing about Dr. Lustig. Dr. Lustig saying that serotonin is bad for you because it's a short-term pleasure, and dopamine is bad for you because it's a short-term pleasure, and serotonin is good because it's happiness. I beg to disagree. What can happen to you once you start taking psychotropic medication that blocks the dopamine receptors, and dopamine and serotonin have to be in balance in your brain for you to be happy. You know what I'm saying? So guess what happens? Your brain gonna think that you have too much serotonin, and you're gonna have serotonin syndrome. Amongst other things, you may have terrible anxiety. And my advice, just go through the anxiety and stick with your medication. Because anxiety eventually gonna pass. Your brain gonna adapt to detecting much less of dopamine, and it's gonna simply calm down on its own. It's gonna just say, hey, fuck, we're just getting this much dopamine and this much serotonin, but this is how it is now, and I'm just coming slowly down to the normal level. Because no, technically you still produce dopamine, your receptors just do not receive the message that you're producing enough dopamine. That's what it is. So yeah, and tardive dyskinesia, well, it may happen to some people, true, but the second generation psychotropic medication, if you take it, the so-called atypical psychotropic medication, guess what happens? Usually side effects show up front, and there is less chance of side effects long term. So instead of being angry with the pharmaceutical corporation of psychotropic medications, what we should do, we should ask them, we should support them in producing third generation psychotropic medication and fourth generation psychotropic medication, and be grateful that we have now medications that produce less long-term side effects. Be grateful, and you don't have to believe in deity, God, or source, or ancestors or whatever. You can just be grateful. And number one thing in CBT, cognitive behavioral therapy, acceptance of reality, radical acceptance of reality. And of course, you can try to change things in your life, which is commendable. But to change them, you have to accept reality first and then work onto the change. And yes, changing yourself is extremely difficult. Okay, it is. The easiest way to change yourself is to change your environment, whether physical or people or whatever. But, it's possible. It takes between 10 to 20 years for a habit to become permanent part of our personality. But it's possible. It takes a long, long time of doing something every day. But eventually, it will become part of our personality. So on this note, stay healthy, and I'm gonna keep on taking my medications as prescribed. And good luck to you. And I do love peanuts, and I'm gonna finish that half of a bag of peanuts today, but it's gonna be off the camera. So have a great time, and click up and subscribe. Thank you.